Now it's my opportunity to share our biweekly COVID report with the board. And there were a couple of public comments, and their questions that they asked or comments that they made will be addressed in this report. So first, I'd like to give some county optics. The county has adjusted its case rate and also its percentage of different groups with vaccination as we are beginning to go through the transition of the term fully vaccinated and merging that with boosted in the public health system. So I'd like to point out that the case rate is per 100,000. And you'll see that the case rate of COVID with Omicron has greatly jumped since the last report on December 14th. Of those who are vaccinated, the case rate is 98 out of 100,000. Of those who are unvaccinated, it's 312.5 out of 100,000. When I reported back on December 14th, the vaccinated case rate was 8, the unvaccinated was around 32, and the overall was also very low. And this plays into what we experienced last week here in our community, in the Milpitas Unified School District community. Here are our latest county vaccination rates as of January 7th. You'll see that those ages 5 through 17 have a vaccination rate of 64%. Those who are eligible to get the booster is 59.6%. And all ages is 82.4%. Now there's a key difference here since Omicron. Eligible with a booster. If you're eligible and you had the booster, then as we look at quarantine, which we'll hear more about in the next 5 to 10 days, then our quarantine time is essentially none if you are a close contact. However, if you are vaccinated and you're eligible for a booster, but you have not received your booster, you are considered along with unvaccinated and would then need to quarantine if you're a close contact. Here, I'd like to point out our case rates, and this is in response to one of our public comments. So on January 3rd, so that would capture all of the cases that we had prior to coming back on January 3rd for school. And you see we have a total of 142 at that point. As of January 7th, which is this past Friday, we have a total of 332. And those COVID cases that you see on our dashboard are cases that are identified through our school district, through our testing system. What you see to the right, all COVID cases as of January 10th, those are the cases that are, in addition to those that we've identified through our testing system, those are the cases that are reported to us either by parents or by employees because they've received results outside of our testing system at another test site. So yes, there are, as you see here, double that we know of, and we're still working on updating because the numbers are overwhelming. We are still working on updating our case count. As we reported last week, we shared with the board the numbers. This is just our classroom staffing needs. So this would include teachers, specialists who provide instruction, as well as paraprofessionals and behavior intervention staff. And you see that last week we had a high of 86 total jobs on January 7th, with only 47 filled and 33 unfilled, with an unfill rate of 38%. And the way that we fill those, as I described last week, was by combining classes, pulling people from the district office who have credentials, as well as those such as Mr. Forstner, who also happens to have a substitute credential, And at the school sites, we pulled counselors and in some cases, school psychologists. What this means is that those people who are filling in the classroom are not able to perform the services that they normally would. So our ability to provide operations for school is greatly limited, particularly as we look at providing operations to our learners, for providing services to our learners. This slide compares last week on Monday, again, the classroom staffing needs, with yesterday on Monday. And you see that there is a drop by about 22% or 18 people. And in part, that's because while there was a need last week for substitutes for some of those people, they were in quarantine, but they were actually well enough to teach virtually. So now some of them are able to teach virtually. This I shared last week as well with the board, and it provides data on student attendance. We're going to focus on January 8th going forward, January 3rd going forward for 21-22. And as I reported last week, the numbers above in the first column are an average of the years 17-18, 18-19, and 19-20. So the years prior to the COVID shelter in place. And you see that we had anywhere from 95 to 96.8% attendance, and the number of absences below that. For this past week, we had anywhere from 92% to 93.19% attendance. And you see the red numbers, for example, on Thursday, underneath the 92.79%, it was 3.87% less than the average of the 3 years prior on that same time frame. You also see that there were 735 absences, just as in the years prior, there were 343 absences. You see under that, 392 more absences, that's in comparison of 735 to 343. Then in the teal colored, you see plus COVID absences, 599. The reason it's separated from the 735 is because those are students who were out for some reason related to COVID, whether it was because they were actually ill, because they were positive, or because they might have been quarantining. And so that would be an additional 599. On Friday, we have an issue with the data and we need to validate it. Yesterday, on Monday, as one of our teachers who made public comment shared, where she said that she hasn't had a full class in several weeks and did have a full class, I think she said -1 yesterday. You see that our data here is similar to her experience, because yesterday we had a 97.18% attendance with 288 absences, which actually is 87 fewer absences than the average of the 3 prior years. And so while we had 147 who had COVID issues that we can count towards ADA, they are able now to tap into real-time learning. In addition to those students who are not able to be in class because of COVID-related illnesses or quarantine, we shared with you last week that even though we were able to make sure there was an adult in a classroom with the students, even if that meant combining classes, we cannot say that we were providing the best instruction possible for those students. In many cases, they simply had packets, and some might consider those packets busy work. By this week, offering students the opportunity based on AB 130, if parents felt concerned for their children's health or safety, parents could participate in either short-term or long-term independent study. One of our other public speakers talked about how in years past, it had to be a minimum of 5 days. That's correct. But with COVID, that's been adjusted. She also talked about how it had to, how in years past, it could only be done one time for short-term independent study. That's correct. Under AB 130, with the conditions of COVID, it can be multiple times as long as it doesn't accumulate more than 14 days. Once it gets to 15 days, then the student would be considered long-term independent study. Now, as we've shared with all of our parents, those who decided that they would like to have independent study because of their concerns for their child's health or safety, if they wanted to do long-term independent study, we can provide that for them. And their principals will share with them, or have shared with them, what the conditions are for that. AB 130 also allows us to have up to 30 days to make sure that all parents who want the independent study, and in particular the long-term independent study, that they have had a conference either with the principal as the program manager or directly with the teacher about the long-term independent study. We have 30 days from the date of commencement to complete those contracts. Here I've illustrated an empty bus, an empty classroom, and a COVID testing sign with nobody around. This is how we felt. This is not just how we felt, but this is what we experienced last week. We heard that all of our bus drivers were out, including the substitute bus driver, and so we had to pull grounds people. We heard that in some cases, we were out of antigen tests. We also heard how much time and effort is being put into making sure that we are able to contact trace all of the students who may be close contacts. And yes, there were multiple communications that went out over the weekend because we learned from the public Santa Clara County Office of Education a couple things. We learned, for one thing, that we don't have the authority to declare a district-wide quarantine. And so we wanted to make sure that the public understood that we know that we can't do that now after talking with our County Office of Education Superintendent, Dr. DeWan. We also know that there were some parents who thought that they had to have independent study. So we needed to make it abundantly clear that independent study is only an option if a parent feels a concern for their child's health or safety per AB 130. So we sent out the initial information on Friday. We sent out another more simplified, clear message on Saturday. And because we still had confusion, we had some of our teachers, including our public speaker, spending a lot of time on the phone or via email with parents trying to explain what the situation was. We had principals doing the same, as well as some of us in the district office, working through the weekend, trying to make sure people understood these three things. There is no quarantine district-wide. If you are already on quarantine, you remain on quarantine. We are open. All of our schools, all of the classrooms, all of the offices. If the teacher is not ill, the teacher is in the classroom. Or if the teacher is not on a leave, the teacher is in the classroom. And again, it is not a requirement that parents do independent study. And I'd like to share that today, Tuesday, the 11th, we have 96% attendance. 4% of that 96 is in person on our campuses. The other 96% of that 96%, no, it's 100% of the 96%. They are on independent study. And all of them on our independent study this week are experiencing live synchronous learning with their teacher from bell to bell, just as the students who are here on campus are doing. Milpitas is unique, just as every community is unique. Different communities throughout the county and the state are dealing with these issues in different ways. Not all school districts experienced what we experienced last week. Some, for example, Palo Alto, they did not have an issue, I understand, of classroom staffing. They had an issue of support beyond the classroom. And so they're trying to deal with it by requesting volunteers from the community to support them. I know that some school districts also are trying to attack the issue of how do we contact trace by looking to see if it's possible, instead of doing that, to submit a, you may have been in contact with a person with COVID, similarly to what we do for chickenpox, the measles. So every community is trying to struggle with this crisis that we have at this time, this surge. We know that this surge, based on the experience of other countries, is supposed to spike. Locally and in our country, the spike is expected to plateau around the 3rd week of January. So when we come back next week, hopefully we will be at that plateau. Additionally, our teachers, our principals, they have to relearn what we've learned all this time about quarantining, because it literally changed on Saturday. And we're still trying to figure it out, but we will get to a point where we can share it with the public with more confidence so that we are ready for implementing it next week. And I want to thank you, board, because the decision that you made in supporting staff's recommendation is very difficult. And we know from parents, a few who spoke up at public comment that night, that for some parents, they were quite concerned because they weren't sure if this independent study was something that they could engage in, or if they even wanted to engage in it. We also know that a large number of parents, either through teachers or principals, or even emails to yourselves and phone calls to yourselves, asking, why can't we have the option of independent study? So you helped us make that an option for them in a way that is meaningful for all. And as we persevere through this peak that we're in right now, I know that we are learning new information. I know that we are constantly pivoting. And I know that with our team, both here at the dais, as well as in the classrooms, on the grounds, in the offices, in the student nutrition kitchen, I know that we are the best team to make sure that all of our learners are served well. And we have an excellent governance board team to help us do that. So thank you.
Thank you, Superintendent.